Have you ever wondered, could taking a shower at night, something that feels so relaxing, actually make your blood pressure more unstable? Today, we'll explore the story of Harold, a 68-year-old man who's had the habit of evening showers for decades, to find out whether it's a healthy routine or a hidden risk few people ever notice.
Hi, my name is Harold. I'm 68 years old and live in a quiet suburban neighborhood with my wife and our beloved dog Max. I'm still in decent shape, not quite at the point of taking daily medications, but I'm also no spring chicken. A few years back, my doctor told me I was in the pre-hypertension range. Not dangerous yet, but something to keep an eye on. Honestly, I've kept most of my old habits. One of them is showering at night. It helps me relax after a long day, especially after gardening or taking evening walks around the block. A warm shower makes it easier to fall asleep, like it's washing the fatigue right out of my body. But lately, something feels off. Every time I step out of the shower, I get a little lightheaded. Sometimes I have to hold on to the sink to steady myself. There was even a time I felt chilled to the bone, even though I'd just taken a hot shower. That night, I struggled to sleep. My heart was racing and my head felt foggy. At first, I blamed the weather or maybe just being overtired, but it's happened several times now, and always on nights I shower after 9 p.m. That's when I started wondering, could showering at night be affecting my blood pressure? I never thought something as routine as an evening shower could mess with my heart health, but now I'm not so sure. At this age, even one fainting episode alone in the bathroom could be serious. I need some guidance. Can showering late at night affect blood pressure? And if so, how should I adjust my routine? Because I don't want to trade a few minutes of comfort for long-term risk.
Harold, thank you so much for your honest and thoughtful question. What might seem like a simple concern is actually becoming increasingly common among older adults: how everyday habits affect cardiovascular health, especially blood pressure. To begin with, showering itself isn't a direct cause of high or low blood pressure. But the timing, water temperature, and your body's natural physiological state at night can trigger unwanted shifts in blood pressure, especially after age 60. 1. Sudden temperature changes can disrupt blood pressure. Our bodies have a sophisticated system for regulating temperature, governed by the autonomic nervous system. When you shower, especially with hot or cold water, your skin temperature and blood vessels shift rapidly. The body reacts by dilating or constricting blood vessels, and this directly impacts your blood pressure. Hot water at night may cause excessive vasodilation, blood vessels opening, leading to a temporary drop in blood pressure once you step out of the shower. That's when you might feel lightheaded or lose balance. On the flip side, a sudden hit of cold water can cause your blood vessels to constrict. Your heart beats faster to compensate, which may lead to a short-term spike in blood pressure. Younger bodies usually recover quickly, but as we age, these reactions become slower or less effective, making it harder to stabilize blood pressure after such rapid changes. That's exactly what you're describing. 2. Nighttime is when blood pressure naturally drops. External triggers can disrupt it. Around 8 or 9 p.m., your body naturally lowers blood pressure as part of its wind-down process before sleep. That's why experts often recommend avoiding heavy meals, intense workouts, or anything too stimulating late at night. Showering, especially with hot water or in a steamy bathroom, can throw off your body's circulatory rhythm during this time. It can overactivate your nervous system and cause restless sleep, irregular heartbeat, mild headaches, postural hypotension, a drop in blood pressure when you stand up too quickly, particularly when exiting the shower. 3. Older adults have reduced ability to regulate blood pressure. This is the most important point. After age 60, your blood vessels lose elasticity and your nervous system responds more slowly to temperature or position changes. So when your body is relaxed in the evening and then gets a sudden temperature jolt, like from a late-night shower, it struggles to adjust in time. That can lead to rapid or pounding heartbeat, feeling dizzy or faint. In extreme cases, even blacking out in the bathroom. 4. Bad timing makes it worse, like showering when you're too full, too hungry, or too late. Many older adults have the habit of showering after dinner or right before bed, sometimes even leaving the bathroom door open to let in cool air. But doing this when your stomach is full, your body is tired, or the room is chilly adds more stress to your circulatory system, causing unpredictable blood pressure responses. In summary, showering isn't the problem. Showering late at night or without precautions is what puts older adults at risk for blood pressure fluctuations. And those can become dangerous if overlooked. When Mr. Harold asked whether nighttime showers could affect blood pressure, it reminded me of many real cases I've seen in my clinic. Most people don't suspect that something as ordinary as taking a shower could lead to serious health risks, especially for older adults. 1. Dizziness, lightheadedness, and loss of balance. Bathroom accidents. This is by far the most common thing I hear from older patients. Doctor, I felt like the room went dark the moment I stepped out of the shower. This usually happens because of a mild drop or sudden shift in blood pressure caused by hot water, or the body's struggle to adjust to temperature changes. In a small, slippery, dimly lit bathroom, this spells real danger. A simple fall can easily result in hip fractures, head injuries, internal trauma. 2. Orthostatic hypotension. Sudden fainting spells. Another serious concern is orthostatic hypotension, when your blood pressure is stable while sitting or lying down, but drops suddenly when you stand up. That drop in blood supply to the brain can cause you to faint without warning. This can happen right after showering, especially if you stand up too quickly from a shower seat. Step out of the shower onto a cold, wet floor. Start drying off or dressing while still damp and cold. The scariest scenario is fainting alone in the bathroom, with no one around, no phone within reach, and delayed help. 3. Increased heart rate, headaches, or trouble sleeping. Some people don't faint, but they do experience rapid heartbeat, a feeling of restlessness or unease when lying down, dull, lingering headaches. Why? Often it's due to overactivation of the sympathetic nervous system after late-night showers, body temperature not returning to baseline before sleep, unstable blood pressure during rest. If this continues for days, it can lead to poor sleep quality, chronic fatigue, and even heart strain, especially for those with pre-existing cardiovascular issues. 4. Increased risk of nighttime stroke or cardiac events in people with heart history. Though rare, I've treated cases of nighttime strokes or heart attacks that were indirectly linked to late, overly hot showers, especially when combined with mild dehydration or alcohol before bathing. At night, the body is trying to stabilize. A strong fluctuation in blood pressure, like from a hot shower, can push fragile blood vessels over the edge. For someone with a history of heart or blood pressure issues, this is a real risk. 5. Lingering anxiety and nighttime worry. One often overlooked effect is psychological stress. When people feel dizzy or have a racing heart after a shower, they may begin to fear bedtime or obsessively check their blood pressure at night. This can snowball into anxiety disorders, chronic insomnia, dependence on sleeping pills, or unnecessary antihypertensive medications. Harold, and everyone else watching this video, I truly understand. An evening shower is a comforting ritual for many. It's a way to wash off the stress of the day, and nobody wants to give that up. The good news is, you don't have to. You just need to make a few smart adjustments to protect your blood pressure while still enjoying your nightly routine. 1. Choose the right time. Ideally before 8 p.m. After 8 p.m., your body naturally starts preparing for sleep. Blood pressure and heart rate begin to drop, and your circulation slows down. Showering too late, especially with hot water, can disrupt this transition and throw off your body's rhythm. Here's what works best. Shower between 6 and 7:30 p.m. after dinner has partially digested. Your body is still alert enough to regulate blood pressure effectively. After the shower, you can wind down gradually and head to bed peacefully. 2. Always use warm, not hot or cold water. This is crucial. Water that's too hot causes sudden blood vessel dilation, can lower blood pressure quickly. Cold water constricts vessels, can cause a temporary spike. What to do instead? Aim for warm water, around 98 102 degrees, 37 to 139 degrees. Avoid skin-burning hot or bone-chilling cold sensations. If you're unsure, test the water with the back of your hand, not your foot. 3. Never shower when you're too hungry or right after a meal. Both are risky. When hungry, blood pressure is already low. Showering can lower it even more. Right after eating, your blood is focused on digestion. Showering disrupts this, affecting both blood pressure and digestion. Better options? Shower 45 to 60 minutes after eating. Or if you're hungry, have a light snack before showering. 4. Keep it short, and always have something to hold on to. Staying in too long causes body temperature shifts that can lead to lightheadedness, especially for older adults. Limit your shower to 10-15 minutes. If needed, place a small seat in the shower, install handrails, or grab bars near the bathing area for extra safety. 5. After showering, dry off thoroughly, stay warm, and avoid walking around too much. After a nighttime shower, your body loses heat quickly if not kept warm. Use a soft towel to dry your entire body, especially your feet and back. Put on warm, comfortable clothes immediately. Avoid walking outside or around the house too much afterward. If you feel dizzy, sit and rest for a few minutes before heading to bed. 6. If you're feeling tired, cold, or unstable, skip the shower and do a warm wipe down instead. Sometimes your body sends subtle warnings: fatigue, chills, or post-workout weakness. On those days, don't push yourself to shower. Use a soft towel soaked in warm water to gently clean your neck, underarms, and back. This helps you stay clean while maintaining stable body temperature. You'll still feel refreshed without needing a full shower. 7. Monitor how your body reacts after your shower. Most importantly, listen to your body. If you feel dizzy, your heart races, or you can't sleep after a shower, that's a sign something needs to change. Keep a log of when you shower and how you feel afterward. If concerns persist, talk to your doctor. Dear Harold, and to everyone watching this video, we've just walked through what seemed like a simple question. Does showering at night affect blood pressure? But along the way, we've uncovered something deeper. That sometimes habits we've held onto for years may need a second look as we get older. Nighttime showers aren't the enemy of good health, but showering the wrong way, too late, too hot, too long, or when your body isn't ready, can cause blood pressure to fluctuate, lead to dizziness, disrupt sleep, or even trigger dangerous accidents. Seniors like Harold can absolutely keep this relaxing routine, just with a few mindful adjustments. Shower earlier, ideally before 8 p.m. Use moderately warm water. Avoid showering when overly hungry, too full, or overly tired. Keep showers short, dry off thoroughly, and stay warm afterward. And if one day your body feels a little off after a shower, maybe some dizziness, a racing heart, or trouble sleeping, don't ignore it. Pause, reflect, adjust your habits, and if needed, talk to your doctor. Our bodies always find quiet ways to send us signals. The question is, are we listening in time? If you've ever felt lightheaded after a nighttime shower or had an experience similar to Harold's, I'd truly love to hear your story. Every body is different, and it's through sharing our experiences that we learn, understand ourselves better, and support one another. Feel free to leave your questions or personal stories in the comments below. My team and I are always listening, and we'll do our best to respond as soon as we can. And if you found this video helpful, consider hitting the subscribe button so you don't miss more health insights made simple and relatable just for older adults like you. Wishing you a peaceful, cozy evening and a deep, restful sleep after a well-timed, mindful shower.